Welcome to OST 149, Cyber Safety Lesson 1, Cyber Ethics and Legal Foundations, brought to you by the Nighthawk Cyber Alliance. This is the first of 4 cybersecurity lessons built specifically for healthcare and medical office professionals. Cybersecurity is no longer just an IT issue. It is a personal, professional, and legal responsibility that applies to everyone who works in healthcare. By the end of this lesson, you will understand why healthcare is the top target for cybercriminals, what the law requires of you, and what the real consequences look like when things go wrong. Healthcare is the #1 target for cybercriminals in the United States. The FBI consistently identifies healthcare as the most attacked critical infrastructure sector in the country because patient data is extremely valuable and many systems are underprepared. Cybersecurity is a legal and ethical obligation for every employee who touches patient data, regardless of job title. Clinical staff, front desk workers, billing specialists. The law holds all of you to the same standard. And a breach in healthcare does not just cost money. When systems go offline, patient care is delayed, records become inaccessible, and medications get missed. The consequences are clinical and human, not just financial. Protected Health Information, or PHI, is any data that identifies a patient and connects them to their health, treatment, or payment. That includes names, dates of birth, social security numbers, diagnoses, prescriptions, lab results, and insurance information. PHI is legally protected in every form it exists: electronic, paper, and verbal. Leaving a printed record on a desk or discussing a patient in a public hallway carries the same legal weight as a digital breach. Medical records are among the most valuable data on the black market, with the average compromised record costing an organization over $500, far above other data types, making healthcare a prime target for identity theft, fraudulent billing, and prescription fraud. HIPAA, the Health Insurance Portability and Accountability Act, was passed in 1996 to establish national standards for healthcare privacy. Before HIPAA, there were no consistent federal rules governing how organizations had to protect patient data. The law is built on 3 rules that work together: the privacy rule, which governs who can access patient information; the security rule, which requires specific safeguards for electronic PHI; and the breach notification rule, which dictates what must happen after a breach occurs. HIPAA applies to covered entities, a broad category that includes hospitals, clinics, physician offices, health plans, billing companies, and IT vendors. If your organization touches patient data in any way, HIPAA almost certainly applies to you. The HITECH Act, passed in 2009, dramatically expanded HIPAA's reach and significantly increased its penalties, earning it the nickname HIPAA with teeth. One of its most important changes was making business associates directly liable. Vendors, contractors, billing firms, and IT companies that handle patient data are now held to the same legal standard as hospitals. HITECH also accelerated the nationwide shift to electronic health records by funding EHR adoption, which moved massive amounts of sensitive patient data into digital systems, making strong cybersecurity not just important, but legally essential. The HIPAA security rule requires 3 layers of safeguards that must work together to protect electronic patient data. Administrative safeguards address the human side: written policies, workforce training, designated security officers, and access management procedures. Physical safeguards control the environment, governing who can enter areas where patient data is stored, requiring workstation security, device controls, and locked server rooms. Technical safeguards cover the technology: encryption, access controls, automatic logoff, and audit logs that create a traceable record of every interaction with patient data. Weakness in any one of these three layers creates vulnerability across the entire system.
The Office for Civil Rights, the OCR, is the federal agency responsible for enforcing HIPAA. The OCR investigates complaints, conducts audits, and imposes civil penalties when violations are found. Every covered entity answers to the OCR after a breach. Large breaches affecting 500 or more individuals must be reported to the OCR within 60 days, and the OCR determines whether HIPAA violations contributed to the incident. Enforcement is not slowing down. In 2024, the OCR closed 22 investigations with financial penalties, collecting over $9.9 million in fines, with enforcement increasing again in 2025.
Civil penalties are tiered based on intent. Unknowing violations start at $137 per violation. Willful neglect that goes uncorrected can reach over $2 million per violation. These are per violation numbers, not per incident, meaning a single breach can generate catastrophic financial exposure. Criminal penalties apply when violations are intentional, with the Department of Justice able to prosecute individuals for fines up to $250,000 and up to 10 years in federal prison. In 2024, the OCR's largest single penalty was $4.75 million against Montefiore Medical Center. And the most cited violation across all cases was failure to conduct a proper risk analysis. When a breach occurs, HIPAA's breach notification rule spells out exactly what must happen. Any impermissible use or disclosure of PHI is presumed to be a breach. The burden of proof falls on the organization to show it was not reportable. Affected individuals must be notified within 60 calendar days of discovery, and that notification must explain what happened, what data was involved, and what steps individuals can take to protect themselves. For breaches affecting 500 or more individuals, the organization must also notify HHS and announce the breach through prominent local media in the affected region. Large breaches are public events under federal law. Legal compliance sets the minimum standard in healthcare cybersecurity, but ethics sets the true standard, guiding decisions when the law alone does not provide a clear answer. The duty of confidentiality that has always existed in healthcare extends fully into the digital world. Protecting your password, keeping your screen attended, and never sharing credentials are all expressions of the same professional obligation you carry at the bedside. It is also critical to understand that system access is not the same as authorization. Accessing any patient record without a legitimate clinical or business reason is both an ethical violation and a federal crime under HIPAA, regardless of your technical ability to open it. The numbers behind healthcare breaches make the stakes impossible to ignore. In 2024 alone, 725 large breaches were reported to HHS, roughly 2 per day. Since 2009, more than 846 million individuals have been affected by healthcare data breaches. The average cost per breach is $7.42 million, the highest of any industry. And nearly 1 in 3 breached organizations raise patient prices to offset their losses. When a healthcare organization fails to protect patient data, every patient the organization serves eventually pays the price, financially and clinically. Hacking now accounts for nearly 80% of all healthcare breaches, up from 49% in 2019, with phishing and stolen credentials as the primary entry points. Perhaps more surprising, over 80% of stolen PHI comes from third-party vendors rather than from hospitals themselves, meaning a single compromised vendor can expose patients across dozens of organizations at once. Most attacks go undetected for an average of 89 days, allowing significant damage to occur long before anyone knows a breach has happened. By the time the alert goes out, the attacker may have been inside for 3 months. In healthcare, cybersecurity failures carry the same professional consequences as clinical negligence. Courts apply a reasonableness standard to digital behavior, meaning a judge or jury will ask whether a reasonable professional in your position should have known better. Employers embed security obligations directly into employment agreements, and federal law holds individuals, not just organizations, criminally accountable for intentional violations. Digital negligence creates personal liability. Intentional violations can result in federal criminal charges. Security violations can lead to termination and licensing referrals. And willful neglect can mean fines up to $250,000 and up to 10 years in federal prison. The strongest legal defense available after a breach is a documented active compliance program. A current documented risk analysis is the single most important record an organization can produce during a federal investigation, and failure to conduct one is the most cited HIPAA violation across all enforcement cases. Encryption is also a critical defense. Properly encrypted data that remains unreadable to attackers does not trigger mandatory breach notification requirements. And the 2021 HIPAA Safe Harbor Law reduces penalties for organizations that follow recognized security frameworks like NIST. Doing the right things does not just protect patients, it protects the organization when incidents occur. 3 cases define the modern healthcare cybersecurity legal landscape. Anthem Incorporated in 2015 resulted in a $16 million settlement after 79 million records were exposed, with OCR finding systemic failures in risk analysis and access controls. Montefiore Medical Center in 2024 was hit with a $4.75 million penalty, primarily for failing to conduct adequate risk analysis, reinforcing that organizations can face steep penalties even without a catastrophic breach. And the 2024 Change Healthcare ransomware attack, estimated to have affected 190 million Americans, disrupted care nationwide, and triggered proposed federal legislation overhauling third-party vendor security standards across the entire industry. Healthcare professionals apply ethical decision-making frameworks to clinical situations every day, and the same process applies directly to cybersecurity. When facing a digital decision at work, follow 3 steps. Step 1. Identify the issue. Ask yourself whether this action involves or risks exposing patient data. Step 2. Evaluate your options. Ask whether the action is legal, policy compliant, and professionally reasonable, and eliminate any option that fails one of those 3 tests. Step 3. Act, document, and report. Make the most defensible decision, document your reasoning, and escalate concerns. Failing to report a known problem is itself a form of negligence under HIPAA. Weak or shared passwords are one of the most common causes of healthcare breaches. Stolen credentials allow attackers to enter systems as legitimate users, bypassing security tools and remaining undetected for months. Strong passwords must be at least 12 characters, using mixed case numbers and symbols, or a passphrase of unrelated words, and must never be reused across systems. Password sharing is not just a policy violation, it is a direct HIPAA violation. HIPAA requires unique user identification for every workforce member. Sharing credentials destroys the audit trail that proves who accessed patient data and when, which is the record that protects both the patient and you. Multi-factor authentication, MFA, requires users to verify identity through 2 or more independent methods: something you know, something you have, and something you are. A stolen password alone cannot grant access to a system that requires a second verification step. Proposed HIPAA security rule updates published in January 2025 include MFA as a required control for all EPHI access, making it a legal requirement across the healthcare industry. Account takeover attacks affected 74% of healthcare organizations in cloud environments in 2025. And MFA directly reduces that risk by adding a layer of verification that stolen credentials alone cannot bypass. Phishing is the most common attack vector in healthcare, with 79% of providers targeted via email in 2024. Attackers impersonate trusted sources, HR, IT, or supervisors to trick employees into clicking malicious links or revealing credentials, exploiting urgency and fear rather than technical vulnerabilities. One click from one employee can compromise an entire network. Red flags to watch for include unexpected credential requests sent via email, mismatched sending domains, generic greetings, and urgent or threatening language. When in doubt, never reply to the suspicious email. Verify by calling the person or department directly using a number you already have on file. Social engineering bypasses technology entirely by manipulating people into granting access or revealing information. Healthcare workers are high value targets because their instinct to be helpful is a vulnerability attackers deliberately exploit, often posing as physicians, vendors, or IT support. Awareness alone is not enough. The only reliable defense is enforced, non negotiable policies with zero exceptions. Never reset passwords or grant system access over the phone without verified identity. And remember, urgency is itself a manipulation tactic. The more pressure someone applies to get you to act fast, the more cautious you need to become. Ransomware is malicious software that encrypts an organization's data and demands payment for its return. Once it executes on a network, it spreads rapidly, locking electronic health records, billing systems, and clinical equipment simultaneously. In 2024, 67% of healthcare breaches involved ransomware, the highest rate ever recorded. Healthcare is targeted specifically because operational downtime creates immediate, life threatening pressure to pay. Ransomware is not just a financial crisis, it is a patient safety crisis. When systems go offline, surgeries get canceled, ambulances get diverted, and medications get delayed, the 2024 Change Healthcare attack disrupted prescription processing for millions of Americans nationwide. Ransomware prevention is patient care. HIPAA requires every covered entity to have a documented incident response plan. Improvising after a breach is not a compliant response. If you suspect an incident has occurred, whether it is a phishing link you clicked, a lost device, or unusual system behavior, your role is to report it immediately to your supervisor or security officer. Do not investigate it yourself. The reason urgency matters legally is this. The 60-day breach notification clock starts the moment any workforce member becomes aware of a potential breach, not when leadership finds out. Delayed reporting creates direct legal exposure for the entire organization. Report what you know when you know it. Remote work and personal device use do not change the legal standards that govern patient data. They just change where the risk occurs. When a personal device touches PHI, all HIPAA security rule requirements apply to how that data is handled, regardless of who owns the device. Remote access to healthcare systems must always use secure approved methods, typically a VPN. Using public Wi-Fi without a VPN to access patient records is a HIPAA security rule violation, even with good intentions. And if a personal device containing unencrypted patient data is lost or stolen, that is a reportable breach under HIPAA. Encryption on personal devices is a legal requirement, not a preference. HIPAA requires role-based access controls, ensuring employees can only view, modify, or transmit the PHI necessary for their specific job. Accessing more than your role requires, even within a system you can technically enter, is a legal violation. Every login, every search, and every file transfer on a work system is logged, traceable, and reviewable by OCR during an investigation. The minimum necessary principle is both a legal requirement and an ethical standard. Before accessing any patient record, ask yourself, do I genuinely need this information to do my job right now? If the answer's no, the answer's also no to opening the record. HIPAA mandates documented security training for every workforce member, making it an enforceable condition of employment, not an optional formality. Signing a security policy acknowledgement is a legally significant act that documents your awareness of the rules. Any violation after signing carries stronger consequences because ignorance is no longer a defense. Noncompliance does not stay at one job either. A HIPAA violation can follow a healthcare professional across employers, states, and licensing boards for an entire career. Security training is mandatory. Violations after signing carry heavier consequences, and HIPAA violations can permanently affect your professional license. Every action on a work system is logged, monitored, and subject to regulatory review. There is no reasonable expectation of privacy on employer-owned systems in healthcare. Forwarding patient data to a personal email, accessing work systems from unsecured devices, or using unauthorized apps all create real HIPAA exposure, even when the intent is harmless. Before any digital action at work, ask yourself one question. Would you be comfortable if your supervisor, the OCR, or the patient could see exactly what you are doing and why? If the answer is no, do not do it. That is the professional standard healthcare cybersecurity requires. Patients disclose sensitive information, diagnoses, mental health history, reproductive health data, substance use, because they trust the healthcare system to protect it. That trust is the foundation of effective care. A breach erodes that trust in ways that reach the bedside long after the technical incident is resolved. Research shows that patients whose records have been breached become less likely to disclose sensitive information to future providers, which compromises clinical outcomes and puts people at risk. Protecting data is protecting people, and that is the core mission of healthcare. Every careful login, every reported incident, every refused credential share is an act of patient care. The healthcare cybersecurity landscape is shifting faster than the regulations that govern it, and the law is actively catching up. The HIPAA security rule updates proposed in January 2025 represent the first major revision since 2013, introducing mandatory MFA, stronger encryption requirements, and more rigorous risk analysis standards. At the same time, AI-assisted diagnostics, networked infusion pumps, wearables, and smart monitors are expanding the attack surface faster than healthcare security governance can currently address. Students entering the healthcare workforce today will spend their entire careers navigating an environment of growing requirements, higher penalties, and more aggressive federal enforcement. Build strong habits now. They will carry you. That brings us to the end of OST 149 Cyber Safety Lesson 1, Cyber Ethics and Legal Foundations, brought to you by the Nighthawk Cyber Alliance. You covered why healthcare is the most targeted sector in the country, what PHI is and why it matters, the legal framework built by HIPAA and HITECH, real-world penalties in landmark cases, and the practical daily habits that make you a stronger line of defense, passwords, MFA, phishing awareness, social engineering, ransomware, incident response, access controls, and patient trust. Cybersecurity in healthcare is everyone's responsibility. Every careful action you take with patient information is an act of care for the people your organization serves. We will see you in Lesson 2,